Spinal Nerve Center Nigeria is the first non-surgical spinal decompression center in Nigeria for non-surgical treatment of back, waist, and neck pain. Physiological sciatica. Before now, it's been spinal surgery in country and overseas. The clinical director and co-founder is a top-rated U.S. expert and decompression specialist. Joining us now is Dr. Craig Slapinski, clinical director, Spinal Nerve Center, Nigeria and Ghana. He's a graduate of the prestigious Palmer College of Therapeutic in Iowa, USA. Hello, doctor. What exactly do you do at the Spinal Nerve Center?
Yeah, well, thanks so much for having me. What we do at the Spinal Nerve Center Nigeria is that we focus on people with severe and chronic back and neck pain.
People complain about neck pain and back pain a lot. What are the causes? What causes this, and how are these conditions treated at the center?
Sure. So your spine is made up of bones that protect the nerve. And these bones are separated by what's called a intervertebral disc. So as we're getting older, or if we're sitting too much, or we're bending or lifting, or we're driving too much, what happens is that intervertebral disc begins to break down. And when that disc breaks down, it bulges out and it'll hit nerves, and that's what causes that severe and chronic pain. So what we do is we focus on getting that disc to retract naturally and safely. So we have a protocol in machines that will gently pull the vertebra apart, and that creates a negative pressure that will help to retract the disc and take pressure off of the nerve.
All right, thank you very much, Dr. Slapinski. So tell us, how is non-surgical spinal decompression a better alternative to surgery?
So surgery is filled with risks, and you never know the outcome. And sometimes you can go into surgery and you come out even worse than you were before. And if that happens, you can't go back and say, hey, undo what you just did. Also, it may work for a period, but then those pains will come back after a couple of years. Something called failed back surgery syndrome is quite common. With surgery, a lot of times what they'll do is they'll do what's called a laminectomy. And that's where they surgically go in and then they remove part of the bone in the spine, or they'll do something called a discectomy, where they'll go in and they'll actually cut part of the disc out. Or in extreme cases, they'll actually fuse the spine so the spine doesn't work. All of these have risks. All of these can have negative side effects. And again, there's no guarantee of the success. Now, what we do is incredibly safe. It's done through a series of sessions where, again, we're just slowly pulling the vertebra apart. So it's very, very safe and it's very, very effective.
Doctor, is this sort of like chiropractic, or chiropractor? And what are other conditions that can arise due to the spinal cord issues aside from the back and the neck pain?
So spinal manipulation is part of what we do, but it's not the primary treatment. The treatment, again, is the machine. So we have the non-surgical spinal decompression table, which again is what's pulling you apart. And then we also have cold laser therapy. And with the laser, what we're doing is we're shining a very strong beam of light into the soft tissue. And when you do that, that stimulates the mitochondria in the cells. The mitochondria are like the powerhouse of the cells, and that produces more ATP. It stimulates the cells and accelerates the healing process. So that's essentially how the treatment works.
So this treatment...
everybody that comes in to see us, yes, go ahead.
So this treatment, you say you have a laser where you push the laser light. It goes on the, what's it called, the mitochondria, then it produces adenosine triphosphate, ATP, or you also have the machine that helps, stretch out the back. Because I just want to know what the procedure is all about. That's what I'm asking all of. And what's the reaction like from the people that come to you on this?
Sure. So the whole procedure takes an hour every time you come in. So it's not just one thing that we're doing. First, we do some electrical therapy with some heat that helps to relax the muscle and takes away some of the pain. Then we're doing the decompression. Then we're doing cold laser therapy. And then there's also an active rehabilitation component too. So you'll be meeting with a physiotherapist and working on getting the muscles that support the spine stronger. Because if you don't do that, then everything that we're doing isn't quite as effective. You need the muscles to be strong to hold everything together. The outcomes that we're getting are quite remarkable, better than I even anticipated. I've been doing non-surgical spinal decompression for about 15 years now. And so it works quite well. Some people notice a difference right away. Some people it can take a little bit longer. Most of the patients that come in to see us, we order an MRI on, so we can get a good look as to what's going on with the disc, how severe the disc is, if there's any other issues, if there's problems with the joint. So based upon that information and the history and the exam, we can somewhat reliably give an outcome or a prognosis, how well the patient will do, how long it'll take.
Okay, thank you.
What's unique about Spine and Nerve Center in Nigeria? What makes it stand out or special?
Well, it's really the first of its kind here in Nigeria. Again, where we have a modality that's quite safe and effective. We're very thorough with beginning from the examination to how we're managing the treatment. We're focused on you as the patient that comes in. So the treatment is specialized to what you have going on.
All right, thank you so much. Now, Doc, does doing barbell squats in the gym put undue pressure on the spine? This is a question that's very specific.
I'm sorry, could you say that again?
I don't know if you know about barbell squats. Barbell squats in the gym.
Squats?
Yes, barbell squats. Oh, I'm not very familiar. Okay. All right, kettlebell or barbell squats. But if you're not familiar with that, that's fine. So I'll just then ask you, how did you decide on setting up Spine and Nerve Center in Nigeria?
How we got started was, well, I was doing non-surgical spinal decompression in the U.S. for a number of years, and my wife is Ghanaian, and so she said, nobody's really doing this in Ghana. Why don't we come to Ghana and open up a clinic in Ghana? And so we did, and we did that about 4 years ago. And then I was getting people from all over West Africa, Liberia, Cameroon, Sierra Leone, and of course, Nigeria. So I was getting a lot of Nigerians that were coming to my clinic. And then I met Dr. Pascal, who brought his mother in to see me. And then he was saying, hey, there's a great need for this in Nigeria. Why don't you come in and open up a clinic in Nigeria? And so that's what we did. So we brought all the equipment, all the expertise that we have here in Nigeria to open it up and help people here.
Right. So, Doctor, are there other things you would like to share with us, like an address of where this is happening? You've already talked about people bringing their MRI when they're coming. What should be the other expectations, and is there more you need to, tell us about this? And I also understand that the center will be commissioned officially on the 22nd of February by the Minister of Health. Tell us more about this, and kindly share some tips, as regards how we can save our backs.
Sure. So first of all, I want to thank the Minister of Health for providing the opportunity for me to come to Nigeria. The government's been really wonderful and encouraging to bring us here, and so Nigerians don't have to travel abroad for their treatment for an alternative to back and neck surgery. The procedure is when you're interested in making an appointment with us, is that you would call our number. We can post it on the page, But you would call our number, and then we'll take some information to see if you're a candidate for the treatment. And then you would come in, you would meet with the physiotherapist. He'll take a history, perform an exam, and then when you have, and if you don't have any imaging, the physiotherapist would order the imaging. And then after you have the imaging, you'll come in, and then I will review it with you. And again, we'll talk about the treatment options that you have. We are having our grand opening on Saturday, which I'm really excited for, and I'm really excited to have the Minister of Health come and help us launch our new clinic.
Doctor, I understand in 2019 you were amongst the best spinal decompression doctors in the USA. Tell us about that. That's something.
Yeah, so I really began focusing on non-surgical spinal decompression about 8 years ago, and I began taking a lot of different courses on it, and I was part of an organization, the Medical Advisory Board on non-surgical spinal decompression, and there was a census taken on who was really involved in it, and I was one of the doctors that was awarded that award.
Well, congratulations. We're glad to hear that, and we look forward to the opening this weekend, as you've mentioned. As we're all excited. Congratulations again, Dr. Slapinski, and we look forward to as many people get information from you. Thank you, sir.